Check 1 2 1 2.
It's a little high.
Check, check.
Yep, I am.
Check, check. 1 2 1 2.
Sanitation is what you need. Use detergent and disinfects. Clean your surroundings, kill them insects. Dispose order, clean them closet. Community bathroom renovated.
Malaria, type of fever, cholera, diarrhea. Sanitation is what you need. So keep the area and safety clean. Always keep the dirt away. Cleanliness is next to godliness, yeah. Sanitation is what you need. So keep the area and safety clean. Always keep the dirt away. Cleanliness is next to godliness, yeah. Sanitation is what you need. So keep the area and safety clean. Always keep the dirt away. Cleanliness is next to godliness, yeah. Malaria, type of fever, cholera, diarrhea. Malaria, type of fever, cholera, diarrhea.
Yes, I do. I've just been there 1 year, and before I was at University of Alberta for almost 4 years. That's where I'm university. And then I was about 20-some years at UT before that. But I love Ryerson. I really, truly do. Yeah, it's an awesome place. And it's got such a great, it's really very interesting. Yeah.
Do you want me to exit out of this?
Pardon?
Do you want me to exit out of this?
Sure. Yeah, and then let's put my front page on.
Okay, good. You want to start from the beginning slide?
What's that?
From beginning?
Yeah. There.
Excuse me, everyone. Okay.
Is this on?
Everyone, please listen up. We have one of the other speakers in the other room next to us. These walls are as soundproof as they can get right now, but if we can just keep it down over here before we start this speaker, please. Thanks, guys.
And on that note, I'd like to introduce David Zakus. He's worked in over 40 countries in Latin America, the Caribbean, Sub-Saharan Africa, East and Southeast Asia, and Eastern Europe as an educator and researcher and public health and health services consultant and professional. He's currently working as a professor at Ryerson University, teaching global health. We are so lucky to steal him away from his busy schedule to have him come to discuss global health with us today. Please welcome David Zakus.
Great. Thank you very much. Well, I am really, really happy to be here. I can't tell you. I like talking to begin with. Thanks so much for the introduction. I'm very excited to be in Sault Ste. Marie. I think it's a great little city. And also, I'm very, very happy, beyond what I can even express to you, to be able to address you today as nursing students. I'm not a nurse, but I have a very strong connection with nursing through my whole life because I was born of a nurse. My mother was a nurse for over 50 years. And when I saw in the little package that I received when I registered yesterday when I arrived at the hotel, there was a little thing in it, lip balm or something, I'm not sure what it is, from the Saskatchewan Nurses Association. And I'm from Saskatoon, born in Prince Albert. But right away, it just made me think of my mother. And I hope I don't start getting really too emotional. She died a few years ago. So I changed my presentation a bit, and I'm dedicating this to her. In memory of her, she died some years ago. But I also have more connection because my older sister, quite a bit older, was a nurse too. And then about, I guess it's 15 years ago. I hate to start talking numbers because it really makes maybe a little bit of a distance between us. But about 15 years ago, I directed for almost 4 years World Health Organization International Collaborating Center for Nursing Development at Mount Sinai Hospital in Toronto. And I gained so much experience with nurses. I became good friends with many of them, including at that time my boss, the Vice President, Dr. Judith Shamian, who's now the President of the International Council of Nurses. And some of you may have met her at the meeting in Korea. I think some of you might have been there. And so I have a very special place in my life and in my heart and in my brain for nurses. And when I talk about global health, because that's what I'm here to talk to you about today, and I'm going to talk to you about what I call global health citizenship. And I'm going to, and I'm labeling this nurses taking leadership. Because when people ask me, well, what kind of skills, work well and can you get a job with or go do something useful internationally, I go, nursing. I can't overemphasize it enough that you all are developing into perhaps the most useful people on earth in terms of the healthcare system. Don't ever forget that. And don't let others push you around, because I know I've worked in faculties of medicine all my life, and I know how things worked at times. So this is in memory of my mom, Josie. She was a registered nurse for over 50 years. She did her training in Prince Albert, Saskatchewan. I think at a hospital that, that's great. And then she ended her career in Surrey, British Columbia, still into her 70s nursing, and she just loved it. And I hope she's watching today. So what is global health? That's the first thing I want to talk to you about. Going to give you sort of a whirlwind tour of global health and global health citizenship, show you a few things from around the world, and share some of my experiences with you. As mentioned in the introduction, I've been very, very, very fortunate for a little guy coming from Prince Albert, Saskatchewan, to have now had the opportunities given to me and presented to me that I've been able to take great advantage of all my life through all types of education and experiences working in 45 countries and having traveled in maybe another 60 or so. So I have a pretty big experience of the world, and I can't seem to slow down. So when the opportunity came to come to Sault Ste. Marie, I said, yeah, for sure, why not? And I love it. And I also know that there's like over 300 of you here attending this conference. That is fantastic. Way to go, nurses. Seriously, I don't know of hardly any other profession, I know a couple, but where the students organize like this and are so well organized and professional that you can do something. And the previous speaker mentioned that too and took notice of it. It is amazing what's going on here in this hotel. And I went on a tour today of a couple of the sim labs at Sault College, and it's really fantastic. So congratulations to each and every one of you for coming. It shows me that you've got real jam, that you've got energy for your profession and for what you want to do in your life. And it's just a great thing. So also I'd just like to say welcome, because I think that we're being watched and beamed around the world a little bit right now. So hi to the people watching us from Rwanda. I was just there about 6 weeks ago, so hi in Rwanda. Korea, Sudan, Nepal, Ireland, Egypt, Japan, and Argentina. Bienvenidos, everybody there. I don't think I've ever had an experience where this is actually happening. So again, you're at the height of technology and communications here, and that is also really, really appreciated. So global health is a concept that has morphed and changed over time. I guess without boasting or whatever, I could say that I was one of the pioneers, because when I started out in my career a few years ago, it didn't exist. And so I had to go looking for a place where I could get the formation I was looking for to be able to kind of do the things I wanted to do with my life. And fortunately, I found a program at York University in the Faculty of Environmental Studies in which they allowed every student to write their own plan of study. So I wrote what we would call today a global health plan. I built on my bachelor's in biochemistry and did a whole master's degree in with lots of environmental stuff as well, but in nutrition, in human nutrition, and then went off to work in Honduras after that. And then ever since then, I've been hardly in one spot for very long. So whenever I'm in Toronto, people say, "Oh, you're here." You know, it's as if I don't have a life in my home city and stuff. But we started out calling it international health. And that was fine. It's still a good term. But it became just associated with kind of student exchanges. It became associated with students who went to the United States. After all, that's, you know, across your bridge there is the United States. That's international. So if you go work in a community or a hospital there, it would be international health. So we wanted to try to find something that distinguished it a little bit more, and also distinguish it from the types of experiences that are very similar to the ones that you would gain here in Canada. So basically, I viewed international health as a focus on the poor, the marginalized, the vulnerable people of the world, but that wasn't really captured so well in the term international health. So maybe about 10 years ago, the word global health started appearing. And it has now taken root, and now we hardly mention international health at all anymore, so everything is global health now. And really it is the issues of service, education, and research, and advocacy. Don't ever forget advocacy. Generally, in an academic environment, you have your service, education, and research, and not in that order. Usually it's research, education, and service. But advocacy is also so important. And as nurses, you have a huge opportunity to be advocates. And you are advocates. You are patient advocates. And so looking at the world as a patient, and we're going to see the world needs a lot of healing in many, many ways. So there are many disparities in health status around the world, including in our own country, including in our own province, our own cities, our neighborhoods. There's huge disparities. So that then makes people want to include Canadian disparities, Canadian issues in the word global, including Aboriginal health. Well, I'll tell you, I just lived in Alberta for 4 years, almost at the University of Alberta. I was a professor there. I learned very quickly that Aboriginal people do not want to be included in global health. For them, it's just another marginalization. They're just being pushed again into some other category rather than being part of the mainstream. So it's a tension in the definition of the word global health, whether it's just international or whether it's global, you know, the global and the local. And so it doesn't really matter because it all has the same mentality, whether it's local or international. So global can be all of that, and you can decide for yourself which definition you'd like. But it focuses on inequalities and marginalization, injustices, and giving voice to the poor. You know, the poor generally have no voice. And about 5 years ago, I was very fortunate to be able to spend 1 year, a solid 12 months, at an organization in Ottawa called the International Development Research Center. And there, it's a donor agency funded by the Canadian government, has a budget of about $200 and some million every year. It has regional offices in 5 countries around the world. And it only funds programs in the developing countries, researchers from there. And when I was there, they had already begun this conceptualization in health systems and stuff where I was working. But ultimately, we developed this idea and this concept that research is able to give voice to the poor and the marginalized and the vulnerable, because they don't have a voice. So that by doing research, you're going out and you can collect data, and then you present that information to others, and in that sense, you're actually giving voice to the poor. So it just goes to show that you never stop getting aha experiences throughout your entire life, because this was just a few years ago, and I'd been doing this already for 20, 30 years, and finally got that realization in my head, and I just want to present that to you too, because that's one of my great learning points in the past few years. And then, of course, global health needs to be based in human rights, a rights-based approach, framing our actions, our activities, our advocacy, our research, our education within a rights approach, which says that we're all equal, that we're not going to do global health because we're so rich and we're going to help the poor people. Well, that's fine. Charity is a wonderful thing, but that's not really it. Why we're doing this, and why I want to prepare to tell you, is that we want to be able to do that to ensure that they have the same rights that you and I have. We have amazing rights here in Canada. We are so fortunate, even though, you know, we have our problems, there's no question, and issues and things like that. But compared to the vast majority of the world's population, we're way, way ahead. And so it's our duty as citizens to try to level the playing field, to try to help others achieve the rights that we have. That's my perspective, and that's what it is all about when I'm going to talk about global citizenship. So that's coming in a bit. So just a few rhetorical questions. I'm not going to ask any hands here, but I just want you to think about these things, about human rights and justice. So do you believe in the rule of law? Do you believe in human rights? Do you believe in the equality of humanity? And lastly, because we're in this field together, do you believe in the right to health, that health is a right? Fortunately, for all of us here, we can say whatever we want and we can answer these however we want, but I would suspect that we all do believe in rule of law, that we do believe in human rights, that we do believe in equality, and that we do believe that health is a right enshrined in our country. So it all comes down to working towards developing and the importance of a global perspective. And why? Why a global perspective? And also an additional concept that I've just learned in the last few years too, about cultural humility. Many times when we're getting ready to go overseas or whatever, we talk about preparing ourselves to be culturally competent so that we can engage with other people from different cultures, not make big faux pas, so that we can try to have an understanding of what they think even about health, how different things are. But this idea of cultural competence was sort of put to the side by one professor I met at the University of Alberta, and he said, that's fine, but we gotta even go beyond competency, and we gotta go to humility, in the sense that when we approach other people in our lives and in our classrooms, in our colleges, and in our society in general, there is no one better culture, one from another. And there are so many cultures all over the world, and everyone is beautiful, everyone has its pluses and negatives, and that we're all in it together. And so when we start looking about global health or international, we know too that our ideas of what it means to be international or global have changed so much over time. This is a map from about 500 years ago, and you know, Canada's not even really on the map. And so, like Michigan is, so maybe Sault Ste. Marie was on the map 500 years ago. None of the rest of Canada was. But the European, this ethnocentric vision of the world was as a flat, and we developed this type of map called the Mercator projection, which actually shows an accurate representation of distances and stuff. But still, it's not where we're at today, because today we are here. This is what we think about when we talk about global health and internationalization. This is our new picture of the world, taken from a spaceship looking down on the Earth. And so this really tells us so much more than that other flat map. The flat map actually, you know, separates China from Canada. It doesn't even look like we're on the same world. You know, you go off to that side of Canada or the United States, and then you just fall off, and it doesn't even. But this one shows us several things. First of all, it shows us the beauty of our planet floating around in space around a star, blue, green, white, has color. It's not just a bunch of rocks or ice. It's the only blue-green entity in the entire universe that has life. We can see so far into the universe. Sure, some people think there may be life in distant planets or whatever, fine. But as far as we know, there isn't. This is it. Would make a little bit of a difference maybe. Somebody the other day, did you hear the latest? That the latest hypothesis is that there are aliens, but they've already gone extinct. So that was some scientist said the other day. And I thought, okay, great. I like that. But this is such a unique place. It also shows us that we're all interconnected. It's actually spinning so fast that, you know, if we didn't have gravity, we'd all be flying off of it. And it doesn't matter where we are, we're always standing upright. But it shows us the interconnections of the world. And that's what's really so important, because today we live in an interconnected, interdependent world. The entire world. There are still a few people who live isolated in the Amazon jungle or in the southern parts of Ethiopia and maybe in Borneo somewhere that haven't come in contact yet with the rest of the world. But generally, we're all interconnected, and we live in what we call an open system. This concept is borrowed from theories of organization behavior, but basically it says that, no, we don't exist in a closed system. The Earth does, for sure. The Earth does exist in a closed system, but as humanity, we're not just Canadians or Ontarians or whatever. We exist in a very interconnected and interdependent world, and it's in our face now every single day. Almost every moment of the day. In fact, the headlines of the news today, Zika virus. Did you know that Zika virus didn't exist in Latin America at all before May of 2015? There was not a single case ever reported. The virus was never detected before May of last year. And now the WHO this morning is calling together, you know, its experts and almost in a panic mode. So we have these various forces and effects of our globalized world. And there's a bit of a list, and I'll just go over it quickly. But we do have pandemics, which is perhaps what's happening right now with the Zika virus. But also another disease that is giantly pandemic is HIV. HIV continues to infect 2 to 3 million people a year. 2 to 3 million people a year still die of the disease, and yet it is also a disease that did not exist more than 35 years ago. Maybe you're not quite 35 yet, but I passed that a little while ago, a few years ago, and it just didn't exist in the world. And now it kills millions of people every year. And you could even figure that out on a daily basis. It would be tens of thousands probably or something. So we have diseases that are crossing borders just as quickly as we travel between countries, and because we're the ones basically carrying the diseases around. And we have giant issues of poverty and maldistribution of income. Did you hear the other day that Oxfam published its annual report? They said that now 62 persons in the world have the equivalent wealth of the bottom half of humanity. 62 people have the same amount of money as 3.6 billion people. There is a rising increase in distribution and maldistribution of income and wealth around the world, and it's actually becoming obscene. And it's getting worse. It is not being corrected. It is going forward, and it's getting worse every year. Last time they reported 2 years ago, it was 300 and some people had that amount of wealth that the bottom half of the world had. Now it's 62 persons. Refugee and immigrant health concerns. There are 25 million refugees around the world, maybe more now because there's, 4 million new refugees from Syria. And this is something that's in our communities now and is with us on a daily basis, many of these issues. So, and we know that a lot of diseases are particular to immigrant populations, right? Economic recession. When there's an economic recession in one big country across that bridge, the whole world, you know, goes into recession. So it's so interconnected, the economies, the economics, the globalization of work and the marketplace. Everything I have on today is made in China. All my clothes. And if it's not China, it's Bangladesh, Vietnam, Cambodia, Pakistan, wherever. So goods are traveling around the world at the speed of light almost, all sorts of things. Politics. The way the political systems of the world are structured, some are much more powerful than others, and some try to tell others what to do, and others try to tell their populations what to do and repress people. And there's all kinds of various levels of dictatorships and democracies around the world, and repression of people, murders of journalists. Did you know that last year there were more journalists killed than any other year in recorded history? Over 150 journalists were killed last year, many of them in Russia and other countries. Very sad situation. In the information age and technology, this is a miracle. Honestly, it truly is. You know, I can check any library in the world almost. I can call my sister in San Francisco. I can take photos with it. I can post things to millions of people. The whole digital age, which is now being called the third industrial revolution, which is just coming to an end now. The fourth one apparently is beginning if you follow the people in Davos, Switzerland last week, all the super elites of the world. They talk now about a fourth industrial revolution where the digital technology gets merged and integrated with biological and inanimate systems, so that now we'll be, you know, becoming more cyborg-like and whatever. And our homes will be, you know, I can turn up the heat of my house in Toronto from my phone and things like that. So the information age has really changed the world. And it will just continue to change the world. We're still, there was a very smart, the founder of management science, Peter Drucker. He wrote a book once, and in the book he said that it takes about 50 years before a transformative technology really begins to take hold. So the digital age is just about 30, not even 40 years old, really. And so it's still in its infancy. So it's just all beginning to happen, and you're in it in a very serious way. So we do have also world organizations, the United Nations and all their affiliated organizations. It's like a giant alphabet soup. I was talking to a student the other day, and I was mentioning the WHO and the UNDP and the FAO and the WFP and UNIDO and et cetera, and he goes, wow, I haven't even heard of any of those, he said. And that's just the start. Including the World Trade Organization is a type of United Nations agency. And then to top it all off, we have globalized crime and corruption. Huge. And the issue that brought that to my attention one day was reading in the newspaper that in the Lower East Side of Vancouver, anybody ever been there where all the drug addicts are and stuff? You can see people injecting heroin. It was on the news this morning too. The mother of her son, she said, you can get heroin easier than pizza in Vancouver. She said in 5 minutes you can have heroin delivered to your door. Well, pizza takes 30 minutes, right? So and then this newspaper article said that 95% of the heroin being injected in Vancouver comes from Afghanistan. This is like 5 years ago when Canada was still at war with Afghanistan. We had thousands of troops there. The Americans had 120-some thousand troops. France, Germany, Australia, everybody all had troops there. And yet they were able to get out of that country to harvest and produce and ship it all the way to Vancouver through organized crime. Unbelievable, in the middle of a war. So, and then we heard about El Chapo, right, being arrested the other day. Everybody's heard about that. You know, his annual income is something like $3 or $4 billion. He has over 100,000 employees selling his drugs and around the world. It's phenomenal. So, we're reaching the beginning of the end of 6 centuries of domination of Western power, Western institutions, and Western values. The world is taking a very dramatic shift right now. Because of all this globalization, what was the ruling class and elite for hundreds of years, the Western powers, England, United States, France, Germany, Canada, kind of a little tiny piece of that. But power is not now only shifting laterally, but vertically too. It's migrating out of the structure of nation states and into the global space, where the instruments of regulation are few and the framework of law is weak. And what is he referring to? He's referring to multinational, transnational corporations. Right now, those companies, the big giant companies, have as much power and more wealth than most all countries in the world. You just heard, did you, about Apple's profit in the last quarter? It was like $6 billion or something, and you multiply that times 4. Their profit last year was 18 or 20 billion dollars. They have, I heard it just the other day, over $200 billion of cash in the bank. Apple. You know, from all of us buying all these Apple things at their very high premiums, they're just raking it in all over the world. So they don't report to anybody. They just report to their own boards of directors. They don't report to a country. And then they try to evade taxes. So it's a very fluid, changing world. The nation states are weakening, and power is shifting in a lot of places. So here's what Obama said a couple of years ago. He said, when you cut through the noise, what's really at stake is how we remain true to who we are in a world that is remaking itself at dizzying speed. Wow. You see that world spinning? And if anybody knows what's happening in the world, it's him, right? He's got all the intelligence agencies and everybody reporting to him of the world's most powerful countries. So if he, in his analysis, says that things are changing at a dizzying speed, watch out. And it is happening. So worldwide perspective on health, all these, I've got 2 pages here, and I'm not going to go over them. And I give my presentation to anybody who wants it. There are so many health problems. Well, first of all, just the right and access to health care services is a giant problem for most people in the world. We would even claim it a bit here in our own country. Maternal and infant mortality, reproductive health, diarrheal diseases, parasitic infections, malnutrition, and obesity now affecting populations at the same time. And how weird is that? That Mexico has the highest rate of obesity in the world. Respiratory tract infections, most of it caused by a preventable thing, smoking. The resurgence of infectious diseases, tuberculosis, we'll see a little bit later. Drug sensitivity, antibiotic resistance developing to a worrying state. The chief medical officer of the United Kingdom says that antibiotic resistance is the greatest health issue facing mankind at the moment. HIV/AIDS, I already mentioned it, tuberculosis, epidemics going on, alcoholism as well, Ebola last year, traumas, accidents, blindness. Traumas and accidents account for 11% of the global burden of disease. About 30,000 people are killed in automobile accidents in the United States every year. So do we ban cars? No. We try to make them safer. But rise of the chronic and non-communicable diseases. Now it's about 60% of the global burden of disease are chronic diseases. Just switched over, you know, not too long ago. And most all countries now, I had a friend, my research assistant, he's Cameroonian, he was in Cameroon for Christmas. He came back and he said, David, he said, well, I was in Cameroon for 2 weeks. 8 of my family died of cancer. I went, holy smokes. He said, cancer is just becoming huge in very poor countries even. And medical interventions versus lifestyle versus social determinants, these are issues that you are dealing with as nurses in your communities and in your practices, you will be. And also issues of traditional and complementary medicine. Anyway, there's a whole other page, and I'm going to skip it over because we don't have time. But you get the idea that there is a lot happening in the world. A lot. And it's not just infectious diseases anymore. It's chronic diseases as well. And then it's all the sociological issues associated with access to health care and provision of health care. This one is particularly important to me. I just was recently working on a large maternal child health project in Ethiopia. Every day, 800 women die from preventable causes related to pregnancy and childbirth. To me, this is one of the greatest abrogations or whatever against the human rights of people in the world today. That a woman would die giving life. It just doesn't make sense. I know it's the way it had been for eons, but today the maternal mortality rate in our country is almost zero. In fact, it's so low in the rich countries that we have to measure maternal mortality per 100,000 live births. Right? What is the statistic in Canada? How many maternal deaths per 100,000 live births? So it depends on how you measure, but it's around 6. But in Ethiopia, it's 600 and some. And it was even 10 years ago, it was over 1,000. That meant, you know, 1% of all women giving giving a child life was dying in that kind of related situation. So it's a very, very sad thing and is a almost totally preventable issue. There have been some good things, though, happen. Poverty is reducing in most places in the world, but one can be a little bit inquiring about this and say, how do you measure the poverty? So, you know, I'll discuss a little bit soon about the Millennium Development Goals, and they said we're going to reduce poverty by 1/2. Well, they started out at $1 a day. Well, if a person all of a sudden makes $1.10 a day or $1.50 a day, does that mean they're not poor? No. So anyway, there's a lot of fuzzy things going on in the measurement of poverty. But poverty is an issue that can be dealt with. And Nelson Mandela, great hero of the world, said, like slavery and apartheid, which he knew well about, right? Poverty is not natural. It's man-made and can be overcome and eradicated by the actions of human beings. Overcoming poverty is not a gesture of charity, it is an act of justice. It is the protection of a fundamental right, the right to dignity and a decent life. And while poverty exists, there can be no true freedom. I think that statement is just so profound, and it gives me motivation. It inspires me to keep trudging along and doing whatever one can. Life expectancy, of course, is increasing, so that's a good thing. We're all living older, even in poor countries. Life expectancy is, but it's a very odd quirk of the situation, because there are so many programs to save babies and people, but yet there is so little emphasis on family planning. In fact, you know, the American Congress had passed acts against their government from promoting family planning and things like that. And then there was just this big thing about Planned Parenthood in the United States. It turned out to be all lies against them. The people who were accusing them have now been charged with whatever it is for lying in public against taking people. But anyway, there are some positive things. Global mortality trends, the under 5 mortality rate and neonatal mortality rates are declining on average. So this is also, again, just like the definition of poverty, what is it? What are you actually measuring? When you look at averages, so much of that is skewed by a few countries that are doing really well, and in particularly China. With 1/5 of the world's population, they've gone up from being the world's poorest country 60 years ago. Did you know that? They were like the most destitute country on earth, and now they're the world's 2nd largest economy in just a matter of 60 years. When their statistics are improving, well, of course the world's statistics are going to improve. But when you disaggregate and you look at still many of the countries of sub-Saharan Africa, Southeast Asia, these under 5 mortality rates and neonatal mortality rates are still really bad. So what is it that we're talking about in global citizenship? It all comes down to rights and duties. As a citizen of Sault Ste. Marie, of wherever you come from, of Victoria or of St. John's, Newfoundland, I heard somebody from Memorial University get an award there or a prize. Kamloops there, I met a student from Kamloops. It doesn't matter where you are, you enjoy certain rights. You enjoy rights by being a Canadian. You have right to health, you have right to justice, you have right to, you know, freedom of speech, etc., etc. But it also implies, to be a citizen, that you also have duties. You can't just enjoy these rights and disregard them or mock them or throw them out the window. You, because you've been given these rights, you have a duty to also help to ensure that other people's rights are protected. So in global citizenship, we're talking about the kind of developing a perspective where you can see the world as becoming a one, like that big globe. It's striving to fight for inequality and inequity, to try to help other people enjoy the same rights that we have just due to our citizenship. And we learn from other cultures. You know, people say to me, you know, aren't you tired of traveling? So many of my colleagues, they're all, you know, in their cottages or whatever. But I say, well, you know, I do get tired for sure. It's exhausting, and it actually seems to get a little harder. I have a harder time with jet lag now. Can't sleep for much after trips and during trips. But every single time I venture out, and I was just, say, 2 months ago, I was in Ethiopia, Rwanda, and Niger, I learned so much. I gained so much appreciation about that globe and about what the world has that it just really keeps me going. And fortunately, I feel like I can do something. I'm able to make a contribution, so that helps. And, but at the same time, there's so much to learn from and so much happening in the world. And so we want to advocate as a citizen, as a global citizen, on behalf of vulnerable populations, whether they be our Aboriginal people or our people living in poverty in Sault Ste. Marie or wherever you come from. So we create awareness amongst ourselves in our own person. We understand what our responsibility is, and then we do something about it. That is what it means to be a global citizen. The world came together 15, 16 years ago to try to put in place this sort of global citizenship for the world. And it's so interesting because we're now even, there's discussion, like Bill Gates said, I don't know if you read his annual letter, he writes a letter at the end of every year, and he said that he thinks by 2030 or something that poverty will be eliminated in the world. Well, you know, okay, good for him. You know, and he puts a lot of his money where his mouth is, so you know, he can say, I personally, I don't believe that. I don't see any much indication that it's going that way. But you never know. But anyway, the world came together and set these goals, these 8 goals. And some were achieved, some weren't. Basically, most of them were achieved to a certain extent. But again, goal 1, though, is, you know, they first set it at $1 a day, but then they raised it up to, I think it was $1.50 a day. And now it's at $1.90 a day, according to the World Bank, that if you earn more than $1.90 US a day, then you're not in poverty. But I don't get that myself. In fact, Ethiopia, a couple years ago, they just, they had a certain percentage of people in poverty, and then they redid their calculations, and they implemented a different definition of poverty and lowered the daily amount of money you need to be called poor, and all of a sudden the 36 million people jumped out of poverty in Ethiopia. Well, I'll tell you, I've been working in Ethiopia since 1990, going back frequently, and it is still the world's 13th poorest country. So even though lots of things are happening there now, it's very interesting. So these goals, now 2015 ended, but these goals 4 and 5, they did not get achieved. Now we have the new Sustainable Development Goals. You probably heard a lot about that last November. It was big news. All the countries of the world signed on. The leaders, many of them were all there in New York, and they signed on to 17 goals now, and I think it's 160-some targets. So there's a lot of cynicism about it because of it just basically covers everything and is not very pointed and focused. But nonetheless, this is global policy now for the next 15 years. So pay attention. It does mean something. And the SDGs, they must achieve. They're intended to achieve 4 extraordinary things: to end extreme poverty, to fight inequality and injustice, to ensure environmental sustainability, and to fix climate change. So let's hope that it works in 15 years. So what influences health? We're all in the health profession. Studies have shown that health is influenced by a whole variety of things. So clinical care only accounts for about 20% of the influence on health of populations, of people. 30% are in individual health behaviors. 10% from the physical environment, and 40% from the socioeconomic factors, the social determinants of health. This is also just a new thing of the last 5 years, the social determinants of health. And now it's showing that they're responsible for the majority of health. It matters where you live. It matters how much education you have. It matters how much wealth you have in determining your status of health. I know of some very interesting studies in Toronto according to postal code. And you can see the areas of the city mapped out where diabetes is common, where hypertension is more common, where all these chronic diseases are very common. So we use what we've got. We use our knowledge on health and well-being, and we can do research, education, service, and advocacy and policy work. So this is how we get engaged. And just a few pictures here of students distributing insecticide-treated bed nets to fight malaria. This has been an unexpected, wonderful intervention for the control of malaria. There's now been something like 250 million bed nets distributed in sub-Saharan Africa. And malaria is going down. It's going down, and now there's a vaccine that's 50% effective or something, but it still kills 1 million people a year. It still affects about 500 million people a year. And if anybody ever had malaria? It is a horrible disease, eh? Yeah, it is not fun, even if hopefully you recover. But anyway, these are some students here. Here's also a group of students from the University of Alberta in Zambia, just not so many months ago, in May of last year. And you'll maybe recognize the person sort of sitting in the front is Paisley Siminek, one of your leaders of the Nursing Students Association. This is from Bogota, Colombia. It was a conference I went to on social medicine some years ago, where at the beginning of the conference, they acknowledged their indigenous history, they acknowledged the importance of their indigenous peoples, and also of the healing aspects of their traditional knowledge in that country. And of course, this isn't the only country with traditional knowledge about health and well-being. All countries have it. Everywhere in the world there's traditional medicine. One thing I learned about from my years in Alberta was about the traditional medicine of Alberta. And one of my friends there is a world expert, and that should be Bogota, not Bogota, Bogota. He's an expert on mushrooms and herbal plants from around the world, but there are 19 plants that are grown and natural to Alberta that are in the Chinese pharmacopoeia, that are in the Chinese medicine history, and they grow naturally in Alberta, so I thought that was so interesting. And over the years, I've been working in China for over 15 years now, I have gained a huge appreciation for traditional Chinese medicine. It is an amazing cultural heritage to the world, and is only beginning to be understood by Western countries. And certainly, though, China is really moving forward. This is a fistula hospital in Addis Ababa. This was started by two expatriate doctors about 30 years ago. They were a couple. One was from Australia, one from New Zealand. They were OBGs. They came and they started this hospital in response to all the fistula they saw amongst particularly all the young women all over the place in Ethiopia. So they started this hospital. They then developed new surgical techniques to cure 96% of any of the women with fistula. 96% are curable with their surgical techniques. People come from all over the world to this hospital to learn that. And I won't get into it, but if you don't know what a fistula is, read about it, because it is a horrible social stigmatism disease. A woman with fistula is literally cast out of her community, becomes a vagrant, an outcast. And it's a very, very sad situation. This is the delivery room. Boy, the sim lab I was in this morning was like way better than that. This is the delivery room in the second biggest top hospital in Ethiopia, at the St. Paul's Hospital, Millennium Medical College, where I've been working for the last number of years with them on the maternal health. This is a bit blurry, but this is their intensive care unit. the only high-tech machine in the whole NICU, it was an incubator. This is the rest of it. They had 2 babies in each bed. That was a NICU. This is in north central China, near the Mongolian border, where they are experiencing the same phenomena of people all over the world in terms of increases, epidemic of hypertension. It is sweeping the world, as is diabetes. Everywhere, those 2 diseases are going rampant. They are pandemics. And here they are, they're in a health promotion, they're having their blood pressure tested, and then they all got a little kit. We had a little spoon so that they could measure salt. Salt's a very important part of their diet, but instead of putting a big spoonful, they'll just put a little spoonful into their food. It had a waistband to measure their waists and several other things in the little kit. But it was a health promotion activity going on with these very rural traditional people. This is in Dar es Salaam, Tanzania, the Aga Khan Hospital, part of the Aga Khan health system. It's very big in East Africa. And very nice hospital where I had students at one time and am associated there. This is in the country next door in Uganda, in Kampala, at Makerere University in capital city, their faculty of medicine and their e-learning lab. And I take this and show you because even though their infrastructure isn't like our infrastructure, they are still learning in modern techniques. They are, you know, right up there. And in fact, for the last few years where I was working before, I had a number of students that would go there and work together with their students. And when they came back, I said, well, what did you learn there? They said, we learned that they know more medicine than we do. And they were the same year in college. We have different teaching techniques. You know, we don't enforce now rote learning and all kinds of memorization like they still do. But my students were just blown away that these poor students in Uganda knew more than they did, and they were really shocked. This is another project that I've been working on, still am, in northern Ghana, and it's the use of traditional song, dance, and theater for health behavior change. Very beautiful, and we had 2 dramas developed, one on malaria and one on diarrheal diseases. And we did a study before and after on knowledge, KAP, knowledge, attitudes, and practices, and found that several of the messages really stuck and people really learned a lot. And it was a really fascinating experience, and we're still going on with it. And this is the kids watching. When we would go into the village, they would just announce that, and then it was a professional dance troupe. They would come, set up their stage, and before we knew it, there were hundreds and hundreds of people. The entire village, including all the elders, the chiefs, everybody came to watch, and they were thrilled and learned a lot. There's so many misconceptions about simple things. One time I had a student in Ethiopia doing a study on malaria, and he did a survey in an area, and he found that it was about 80-some% of the people thought that malaria, the fever, they didn't have like a name malaria, it was called the fever, was transmitted by eating a dried corn stem. That's what they believed. So just a simple intervention to tell them that the mosquito that's biting them could potentially be carrying malaria and to hit it, rather than just live with the mosquito as a friend. Which is the way that people live in their environment with the insects and stuff. You know, they don't see them as enemies like we do with carrying diseases and stuff. So anyway, lots that can be done. This was a beautiful sight of the Himalayas flying into Kathmandu a couple of years ago. And this was flying over India. No, it's just a joke. This is I want to mention, too, in the little bit of time I have left, about the use of modern technologies, of information communication technologies in health. This was a presentation I gave a few months ago at Peking University in Beijing, followed up from one 5 years ago in which we had quite a large conference on global human-centered e-health. E-health, or M-health, mobile health, electronic health, is becoming very, very popular now and a very important tool. And for any persons from York University, that's Dean Harvey Skinner, the Dean of Health, and the School of Nursing there. And this other guy here is Alex Haddad, who is at the University of Toronto and head of the Global E-Health Innovation Center. and the e-health laboratories at the Toronto Hospital. So this is a project where I'm currently working now. My research assistant is there, the guy from Cameroon I mentioned. These are a community health worker with an interviewer. And these community health workers are being trained to treat 3 childhood illnesses: diarrheal disease, pneumonia, and malaria, all extremely prevalent in their communities. Niger, when I first got involved in this project, it's a World Vision project, and they asked me to help lead up the research part. I looked at the Human Development Index from the UNDP. Niger was last, 186th in the world, absolute bottom of all countries in the world. And it's just so interesting, and yet I've had some of the most beautiful, heartwarming experiences that I've ever had there. Here's another health worker in the yellow talking to a mother who's come with her sick child. And now we've introduced smartphones to 100 of the 1,000 trained community health workers. And the smartphone has a pre-programmed algorithm to take them through a diagnosis, treatment, and prescription, and control of their kit of drugs. The blue box is full of different drugs. They even have antibiotics because they're treating pneumonia. This is a bit controversial, that you have an 8-day trained community health worker giving an antibiotic, but otherwise these children would have absolutely nothing. They're isolated. They live very far from the nearest community health center where there's a nurse. And anyway, it's a whole system that's happening now, and it's very, very interesting. And this is just a picture from my phone one day. You can see it was 39 degrees. Says feels like 42. And then the next day was going to be 41. Anyway, it's a dry heat, as people from Saskatchewan say, right? It's a dry cold. Yeah. Yeah. This was in rural India, just about 2 or 3 hours outside of New Delhi a few years ago, where it was in a hut, and there were 2 guys, like this guy here with his laptop and the little machine. You know what he was doing with the little machine? People were coming in with their filled out forms. He was making them health information cards with a chip on it, so that they have an electronic health system in these villages all over India. So hundreds and hundreds of millions of people all throughout India have an electronic health record. Do you? I don't. I was flabbergasted. I couldn't believe it. It was his computer, if he closed it, it was all covered in dust and everything. And then out of that little machine, out pops the little smart card with a computer chip with all the information, everything on it. Fascinating. Here's another use of mobile health, mobile technology. This is actually for animal control, it's tracking lions and things. But here you can see a very traditional person holding a satellite-connected phone and putting in data whenever he sees, I don't know, a lion do a kill or something. So the key messages: cross-cultural learning and empowerment, cultural intelligence and humility. It's so important that we, and we in Canada have the absolute best chance of really becoming global citizens because we are a globalized country. There's no question. Creativity, innovation, and impact, get the message out. We need new ideas. I was looking at some of my notes from university that were 30 years old, from 1986. I could be teaching them today. It's so sad. Same problems, almost exactly the same. So we need your creativity as young people. We need new ideas. We really, truly do. We're stuck in all kinds of bureaucracies and everything, and it's very difficult. The 3 E's plus 1, effectiveness, efficiency, equity, and environment. If you take nothing else from this lecture away, remember the 4 E's, because they can guide any kind of analysis that you are trying to do. Strive for human rights, use it as a framework for your work, and integrate and be with communities. Community engagement is it, I think, my feeling. We need more and more and more engagement with real communities. Somebody the other day, some people, they're putting together a global health program, they asked me, what do you think is one of the most important thing that we should take into consideration? I said, community engagement. You've got to be involved where health happens, in the family, in the household, in the communities, whatever it is. build disciplinary and multidisciplinary collaborations. Multidisciplinary collaborations are the, whatever the word is, all the donors are expecting it now. All the granting agencies, you have to be multidisciplinary. On-site engagement, strive for quality and excellence, etc., and blend medical science, modern, with public health and social sciences. My bottom line from all of my life's work is that true change comes at a person-to-person level. Oh, I can write all these things and, you know, and teach and do all of this kind of stuff, but it's really the person-to-person level. So you've got to be out there. You've got to be in the communities. Another one of my great heroes, it's interesting, they're all of African heritage. This is the great new problem of mankind, Martin Luther King Jr. said in 1967. We have inherited a great world house in which we have to live together. Black and white, Easterner and Westerner, Gentile and Jew, Catholic and Protestant, Muslim and Hindu, because we can never again live apart. We must learn somehow to live with each other in peace. So I just basically end there. Remember where we are. This is it. We have to create peace. I fully believe that as health workers, you are peacemakers. This is so important. Never forget that you're peacemakers at the bedside, you're peacemakers in society in general. You have such skills that people respect and can influence people. So your future, my future, depends on what you do with your life, your talents, your ambitions. Become a global health citizen. Just very quickly before I finish, this is a relatively new paper written by one of the nursing professors at Ryerson about international internships on social development led by Canadian nursing students, published in Nurse Education Today. If you're interested in global health to read more, this is a really good textbook. I have a chapter in it on and I also, and I've got many cards here to hand out, I publish a weekly newsletter called Planetary Health Weekly. It's a collection of news articles that I read. I read a lot on a week-by-week basis on global health and ecological wellness. Because a few years ago, it just became so apparent to me that we must integrate the environment, the health of the environment, the health of our ecosystems, into everything we do and talk about. It is one of the greatest challenges confronting all of us on that big, beautiful blue planet. We're you know, unfortunately, I hate to even say it, we're trashing that beautiful thing, that unique creation that's floating around in space. It is being damaged in a way that is very severe. And it's not irreparable, but it's changing, and we know it's changing. I left yesterday, Toronto. It was 6 degrees when I woke up yesterday morning. January 27th. That is strange. There we go. Take it with you. And thank you so much. I'll be here all day tomorrow if you'd like to talk with me. I'm around. I like talking with anybody. And thanks for talking about these issues, thinking about them. And good luck to you all. And I don't know if we have any time now or not, probably. Couple minutes if there's any burning questions.